I'm Constantine Tam. I'm a hematologist at the Alfred Hospital in Melbourne and a professor of hematology at Monash University, both in Melbourne, Australia. So the SEQUOIA study is a registration study for Zanubrutinib, which is a next generation potent BTK inhibitor. And prior to the SEQUOIA study, we know that from the Alpine study that Zanubrutinib is safer and more efficacious compared to ibrutinib in CLL. So SEQUOIA study is a frontline study. The main comparison is between Zanubrutinib and bendamustine rituximab. That result has been published multiple times and shows that Zanubrutinib is superior. The particular presentation at ASCO this year is about those patients who are found to have 17p deletion at the time of study enrollment. Because these patients, it is not ethical to randomize these patients to chemotherapy, so they were all assigned Zanubrutinib as a monotherapy in a non-randomized arm, the so-called arm C. Now, the arm C of this study actually turned out to be the largest cohort of patients with 17p deletion CLL treated with any regimen ever published. And this is a cohort that is larger than the collective experience of ibrutinib and acalabrutinib put together. With a 5-year update that we presented at the ASCO conference, we showed that the progression-free survival is 72% at 5 years. And if you compare this against patients without 17p deletion in the same study, their progression-free survival was 75%. So 75% without 17p deletion, 72% with 17p deletion. I think what that really illustrates is that Zanubrutinib is able to neutralize the risk of p53 deletion in patients with CLL. And additionally, if you look at those patients with what I call a double whammy, so patients with 17p deletion and an unmutated RGVH status, so the two poor prognostic factors together, their outcomes are just as good as those with 17p deletion and no additional risk factors. The overall survival at 5 years is 85%, and this is a really testament to how far we've come in this disease, because when I first started treating CLL, the overall survival of these patients are less than 3 years. And now we have an overall survival of 85% at 5 years. And in total, what the SEQUOIA Arm C study really shows is that in a large cohort of patients, 110 patients, uniformly treated for 17p CLL, that we have set a new benchmark in the outcome of this disease. And Zanubrutinib is able to overcome the negative prognostic factors of both 17p deletion and RGVH and mutated status. So the historic outcome of BTK inhibitors in the treatment-naive 17p population have been pretty good. So most of them are projecting at roughly the same progression-free survival as what we have in the arm C arm here. However, what the difference is that the previous experiences are very limited. So ibrutinib, acalabrutinib, we're talking about less than 50 patients, and now we've got 110 patients, all treated on the same trial with the same drug. So the results really, I think the difference in results is that we're presenting the most robust data set there is out there. This is a large group of patients, and we're very sure about the excellent outcomes. Now your question asked about how does this compare historically to what we have with 17p deletion, and this is light and day. Like, we know that with chemotherapy that these patients do not respond. We know that with venetoclax-based therapy that these people have a median progression-free survival of 4 years. So really, this is the best data we've seen in 17p deletion CLL, and really for the first time, showing that for patients with or without 17p, they're doing just as well with the same therapy. So the response rate is 97%, meaning that virtually every patient who took the drug responded. We knew that BTK inhibitors are very effective in a CLL, including 17p deletion. So I think the high overall response rate is gratifying to see, but not surprising. We expected these outcomes of these type of drugs. The complete remission is 18%, but that's not that low. So we know with BTK inhibitors that the results, the complete remission rates are relatively low at first and they mature over time. So an 18% CR rate at 5 years is basically par for the course. And the important thing about BTK inhibitors is that you do not need to achieve a complete remission to do really well. We know that most patients are in partial remission, maturing into complete remission, and those patients have excellent quality of life and durability of response. So you do not need to get into complete remission to do well. So one difference between the SEQUOIA study, which we presented today, and the previous studies is that the SEQUOIA study, to get in, you have to be old and unfit. So these are all real-world patients who are older, who have got comorbidities, who are not chemotherapy fit. And in addition, they've got 17p deletion. I think that this is a really robust data set. I mean, these patients, despite being older and unfit and having 17p, they are having excellent survival and progression-free survival. We looked at the side effects of these patients. Atrial fibrillation happened in 8% of patients after 5 years. Hypertension in less than 20% after 5 years. Infections were not increased. So I think this is a really robust data set that tells me that next time I have a 78-year-old patient with 17p deletion CLL, that the most reliable data is with Zanubrutinib.